Yeah. So I always say, first and foremost, before you treat your patients and interest in patients, as a woman myself, it was realizing that I myself could be someone who has an adverse outcome from pregnancy or from a cesarean section. And so my interest in this was personal as well.
Hello, everyone, and welcome to the Global Health Unfiltered podcast, a podcast about unspoken realities about global health in Africa and the world. I'm your host, Desmond Jumbam, and I'm joined by my co host, Ulrich Sydney Kamunye. Hey, Ulrich.
Hi everyone.
So, welcome to our second season, and welcome to the new year. We're so happy that you joined us last year and that you continue to listen to our episodes and our podcasts. One of the goals of the podcast is to highlight African global health leaders, young global health leaders that are really at the forefront of leading public health initiatives on the continent. And we have just one such leader with us today to open our second season. So we're excited um, to have with us Professor Salome Maswime, who is joining us from Cape Town, South Africa. Salome Maswime is professor and head of global surgery at the University of Cape Town in South Africa. She trained as an obstetrician and gynecologist and is the president of of the South African Clinician Scientist Society. She was the Discovery MGH Research Fellow in 2018 at Massachusetts General Hospitals and Harvard Medical School, and also a former lecturer at Wits University in South Africa. So Salome is originally from Limpopo province in South Africa, and after qualifying for a medical degree at the University of Kwa-Zulu Natal, she then went on to complete a fellowship and a master's in medicine degree in obstetric and gynecology and a PhD as well. She has worked in various hospitals in South Africa, including the Hani Baragwanath Academic Hospital in Soweto. She's a global surgery expert with significant research contributions, multiple awards that she's won. She's a strong and passionate advocate for women's rights and women's health um, and health equity, especially focused on surgical care. She has numerous accomplishments, many of which we don't have the time to go through in these introductions, but we're very, very delighted to have you with us, Salome. Welcome to Global Health Unfiltered podcast.
Thank you so much for having me.
All right, so let's get right into it. You're not only a medical doctor, but you also decided to go and get your PhD in obstetrics and gynecology. So by definition, you're a physician scientist, right? Can you tell us why did you decide to become a physician scientist, and what has that experience been like?
Thank you so much. So I think firstly, when I went down that route, I didn't know that there's such a thing called a physician scientist. I discovered it along the way. But essentially, my journey was to become an obstetrician and gynecologist. And that was driven by just what I experienced as a junior doctor in maternal and women's health. And this was basically running a labor ward in a rural hospital. You
Hmm.
start dealing with women having adverse outcomes, mothers dying, babies dying, and just starting to see as a young doctor that the systems were not in place. But at the time, I thought that my knowledge, increasing my knowledge will help me to save more lives. But after I went down the journey of specializing, I realized that it will take a bit more than being a specialist to improve systems. And so that's how I ended up moving into this research path, particularly with my interest in cesarean section outcomes and trying to understand how to save lives from bleeding during and after cesarean section. And that kind of moved into my next chapter in medicine, which was really, on one hand, treating patients, on the other hand, trying to find solutions and answers and developing new systems. So that's kind of how it evolved.
Oh, wow, that's amazing. And it so you decided that you needed more than providing care, right? You wanted to study to better understand the challenges that women were facing and come up with solutions. And since becoming a physician scientist, can you tell us what that looks like in practice? Like what has your experience been?
Yeah. So initially, I was working full time as an obstetrician and doing my research on the side. Tried developing a research unit while I was still in Wits, and
Mm,
then got interested in global health because what I started seeing was the disparities between countries at first, and that sparked my interest in global health and led to me doing a postdoc in the Massachusetts General Hospital Center for Global Health and Harvard Medical School. And so that kind of moved me from, clinical practice to research to systems, and even more into systems thinking and all of that. So essentially, I moved into this global health space where a balance between doing research in global health, education, and running a teaching curriculum in global surgery, and also working very closely with the clinicians and surgeons who are responsible for the clinical outcomes.
Oh, so you've conducted very impressive research and some would even say groundbreaking around access to and quality of maternal surgical care in Africa. So, what motivated that specific um, aspect of your research?
Yeah. So I always say, first and foremost, before you treat your patients and interest in patients, as a woman myself, it was realizing that I myself could be someone who has an adverse outcome from pregnancy or from a cesarean section. And so my interest in this was personal as well, in that, what saves us as African women from being victims of systems that are failing, but also with the patients that I treated, where I felt like I could have done more, or we could have saved this life if we were in a different institution at the time, or if we had more resources, or if things were structured differently. So I think it was my frustration working as a doctor who's trying to save lives, but realizes that it's not just about me and the patients that are in front of me. There's a whole system. And sometimes I'd visit other hospitals and review maternal death files and realize that this life could have been saved, except this person didn't know who to call or what to do at the time. So that was really my motivation, feeling that we can offer more to African women. And as an African woman myself, feeling that, I owe it not just to myself, but, it could be my sister, it could be my friends. Who knows who else will have an adverse outcome because of poor systems.
Well, so I guess it is fair to say that through you pursuing that path, you've been able not only to touch the lives of those patients that you would see normally in your consultation room, but actually expand the impact of your research, but also your practice to other women, not only within South Africa, but across the continent. So, what has your research so far told us about the current state of maternal health in Africa, and perhaps what are like the main challenges that African women currently face in accessing safe surgical care?
Yeah. So I think the first thing, that came out of my research was understanding that that outcomes, cesarean section outcomes, are driven by health system factors. And so, as a typical gynecologist, or as a typical clinician or surgeon, when we looked at cesarean section complications, my instinct was that the problem could be solved inside of a theater. But as we reviewed those files, as we reviewed the cases where women had either lost their lives or had severe complications, it was clear that it was, how long they took to get to the hospital. Those who had not attended clinic would have worse outcomes. The ambulances, the referral times, the availability of medications, those are the things that we started to pick up. And so that first understanding that you need a functional health system to have good surgical outcomes. And then as part of the African Surgical Outcome Study, where we of course found that African women were 50 times more likely to die from cesarean section complications than women in high income countries. And again, that was just putting a light bulb on the issues that were there, that, women are dying in our midst because of systems and because of things that are not being done, or things being done incorrectly that could be prevented. So I think my work has really created awareness, raised awareness, but brought different stakeholders into the room, from the politicians to the clinicians to the managers. And what we try to do is to sit together and say, what can we do to make things better? And so that is what I really try to do.
Hmm.
Salome, every time I hear that statistic about African women being 50 times more likely to die after a C-section, it just blows my mind at that disparity. And quite honestly, I think that, from what I've read of your research, that's one of the most impactful studies that you and your team have done. But I'm curious, how what the reaction has been to that particular statistic. I remember when the study came out, it was featured on CNN and BBC, and all of them picked it up. But was there any kind of concrete action as a result of this horrible statistic? Like what can you say about that?
Yeah, and I think that's one of the challenges with health systems work, because at first, there's that moment where everyone hears the statistics and it's like,
Mm,
someone needs to do something, but no one raises up their hands to actually do something. And so and so it's very difficult to quantify and say what has been done over time. I can certainly tell you that from the days when I started speaking about uh, women's outcomes or cesarean section outcomes, there's a lot more awareness and understanding and drive to do things better, especially in our African communities. And even if it's just locally, where I am with medical students, these principles are now being taught and infiltrated. But it's not always easy to quantify, to say, have we reduced anything? But what I can certainly say to you, that I think at all levels, there's a lot of dialogue that happens. There's a lot of systems work that is going on, and interventions that are being piloted to say, what can we do differently? But it's not something that we're gonna see the change overnight.
right.
With health system strengthening work, it's what you want is sustainable change, and with time, we hopefully will see differences in our outcome.
Right. Yeah, you're absolutely right that it takes long-term commitment and constant advocacy, and really stepping out of the classroom, stepping out of the research. Right. It's publishing that research. It's not the end of the road. So we have to constantly continue to urge the politicians and the decision makers to do something about it. But you mentioned, some of your work with medical students. You and I have known each other for a couple of years now, and I remember when we first met in Boston, and you were doing your fellowship and trying to decide what is next. I mean, you're pretty quite a hot cake, like I remember, you had options from so many different universities, but then you ended up with an amazing opportunity to work at UCT, to set up the division for global surgery, which now you are the head. And just as of last year, you were promoted to full professor, right? One of the youngest in the nations, if not the continents, right? So congratulations on that.
Yep.
That's amazing, and that's exactly you're exactly the type of person that we aim to have on the podcast, to show that there are young African leaders, public health leaders, global health leaders that are advancing the cause of global health on the continent. But I wonder if you can take us through the journey of setting up the division of global surgery at UCT, and what that experience has been like. How has that been like, setting up that whole new um, focus on global surgery at UCT?
Yeah. So I remember coming into a UCT middle of 2019, given with this exciting and huge task to start global surgery as a new academic discipline at UCT. And what I had was an office and my handbag, and kind of, see where you take this, and let's we giving you 3 years basically to develop this into something. And I had what was good was I had a clear vision in mind, and what I wanted to see in the long run. But of course, I needed a team. I needed buy-in from the people around. I needed money, because if essentially, you can't run any program without money and resources and finances. And it went from literally myself in one office to developing a division where we now have about 10 staff members. We've got many committees. We've got a lot of people at UCT vested in this, and part of this, what we made our main focus was global surgery education. And what I felt was that, they call it righteous anger when you want to fix something, but and your convictions are there, but you need a plan, you need a strategy, you need to know how systems work, what are policies. And in the global surgery world, there's been a lot of intervention, but without people spending their time to understand how things work. So I felt, I'm an obstetrician. All I've learned is how to manage pregnant women. How do I move into this policy space and this global health space without knowledge and understanding, and without laying a foundation? So I felt, as UCT, that is what we could contribute to the world, creating a curriculum where we teach people and equip them to go out and make the change before they go up and mess up things for the rest of the world. So that has essentially been the journey. And to date, we've developed an MSc in global surgery, a PhD cohort. We've got an MPH course called Fundamentals in Global Surgery, which is primarily for MPH students. And we've got an executive leadership in global surgery course, which we run through the graduate business school. So it's been, 3.5 years, going on our 4th year soon. That I think in this time we've been able to one, raise money, create programs, attract students, and employ staff.
Wow, wow.
Yeah. Um, uh, it is very impressive to see when we look at your track record so far. It is one of, you identify a problem and you come up with a solution, and you're not scared of going in uncharted lands, from being an obstetrician, gynecologist, clinician, to being a physician scientist, to being an educator, to being the head of a global surgery division. And each time there is its solutions that comes out. So that mindset of not only coming up with solution, but chatting uncharted territory, basically. What is your framework, for example, to not only identify the problems, the right solutions, but also knowing, because when you're going on uncharted territory, it's like there's not always the right guidance. So how do you navigate all this?
Yeah. So I think just like everyone else, I'm able to see problems. And I think all of us are very good at seeing problems. And I think the world needs more people that find solutions and help fix those problems. And I think there are ways, of doing that. And maybe when I was much younger, I was doing it at a very small scale, and you practice and you start to trust yourself. But essentially, you need people, you need champions. And when you find a problem, one, let's diagnose it correctly. Two, let's build a team. And then as a team, we can work out what are the possible solutions. And you pilot things. You don't go and scale up things before you understand how they work. And I think these are kind of the principles that I've always tried to use. And whilst, yes, we're trying to fix a very big problem here, of global importance, but I think finding principles such as make friends, build a team, find solutions together. Yeah, and so the answers have never had to come from me. My job has often been to facilitate the discussion and then come up with, manage the process. And people will volunteer to do things, and people will take up responsibilities and roles when they see that this is for a good cause. So it's really been, trying to apply some of those leadership principles in what I do.
Yeah, it's definitely working and definitely impressive. We can tell by all the accomplishments. And so going back to diagnosing problems and coming up with solutions, one of the biggest problems we've all seen recently was the COVID-19 pandemic. And a lot of your work prior to the COVID-19 pandemic identified a serious issue with access to quality maternal surgical care. So my question is, what has been the pandemic's impact on that situation for maternal surgical care, and what are some of the solutions you came up with to count to mitigate the effect of the pandemic?
Yeah. So one, from a global surgery perspective, one of the benefits of the pandemic was people starting to understand the language that we speak, and starting to understand that this is all about health systems. This is about lack of oxygen. This is patients that need to be operated on that cannot be operated on. And so I think it also created a good space for us to advocate and to get an ear from people that previously would not have listened to us and understood us. From a maternal perspective, I on one hand, I led the South African, as one of the co-PIs on the pregnancy COVID-19 in pregnancy study, and again we were able to see the adverse outcomes, that they were increased in pregnant women, higher than expected, more ICU admissions, and so the severity. Some of the things that we rallied for in South Africa was motivating for vaccinations to reach pregnant women earlier, creating awareness. I was involved in a lot of webinars, including to obstetricians and gynecologists and doctors, to say this is the situation with pregnant women and how can we offer better care and services. I mean, at the beginning, one of the things was pregnant women were not mentioned in many things. So they didn't know whether to attend clinic or not, whether to go to the hospital or not. And I think this resulted in some complications that could have been prevented. But in many African countries and in South Africa, the mortality rates did go up. And whether it was because of COVID itself or health services not reaching those that should have, and there was a lot of that going on. I don't know what the recent stats are, but I think things have kind of stabilized now. But the pandemic did set back a lot of initiatives that had been done prior in reducing global maternal mortality rates and perinatal mortality rates. And I think there's a lot of rethinking, how do we now catch up and improve things at a faster rate now that we had this long disturbance.
Mhm.
Salome, it's a new year. I'm curious, what are you excited about in this new year? What are some things that you're looking forward to?
So particularly with my work, I feel like for the first time I can have a normal year. I haven't had a normal year because every year it's been like, okay, lay the foundation, build this, build this.
Mhm.
And this year is one of those years where you come in and we've got this course from this time to this time, we've got this number of students, we've got this program, we've got these trips, and it's just been, I've been more excited about having a normal year which is going to be a bit more predictable. But I'm very excited about our executive leadership course in global surgery, which will be starting in the middle of next month. And already we've had an excellent number of applications and just surgical leaders from the continent, ranging from heads of departments to deputy deans. We've got a vice chancellor that's a surgeon. We've got people that are in government, and it's really exciting to see leaders in surgery coming to Cape Town to come and learn more about global surgery and surgical leadership. So that is gonna be one of my highlights that I'm looking forward to.
Well, it sounds like a very exciting year. Lots of amazing opportunities around global surgery, the executive leadership program, the master's programs, and lots of exciting opportunities at UCT. I like the word predictable. The future is never predictable, but it's more predictable now than over the past 3 years with COVID. So I like that. I wish you a very predictable 2023. Um, I think we'd like to close out with your advice for young women and men in Africa around the world who are interested and very passionate about improving healthcare in their communities, but they face significant challenges. I know you face significant challenges in your career to get to where you are. So, what advice would you give, a young woman in, Nairobi or Mauritius or wherever they are, on what they should be thinking about, what they should be doing right now.
Yeah. And I'll just start by even just highlighting, one of the things that shocked us with our applications for the course, they came from lots of men,
Oh, yeah.
So whilst you've created an opportunity for men and women surgical leaders throughout the continent to come,
Mm,
a lot of women still don't raise their hands because they think it's for someone else, or they think they're not the right person, or.
mm,
And I think it's at some point we need to just raise our hands and not be afraid, and try to fix things, and try to see what contribution we can make as women. And I think, if anything, that's what I want to inspire other women to do, to say, don't wait for the next person. You probably are that person, and to not be afraid of things going wrong, or waiting for the next person. Too often we're waiting for someone that might never come. So we need to believe in ourselves and take a chance. If things don't work out, they don't. But if they do, you could be saving many, many lives. And so we should be more willing to take chances to improve things for others in this world.
daring to take chances. I like that. I like that. Yeah.
Yeah, and I think that with that recommendation, it is important that we highlight that our guest today, Professor Maswime, is very reachable on social media. So we'll be sharing below the podcast links to her social media handle, to the Masters of Science. No matter where you are, you should be applying the PhD, the executive leadership, and especially if you're a woman, you heard it here first. So you should be raising your hand. You should be going out there, taking a chance, not only on yourself, but also on the opportunity for whatever cause you're advancing, to actually get a chance to be fortunate enough that you would be a leader for that opportunity. We thank you so much for making the time to be with us today and sharing not only your experience but inspiration, because we believe that this is going to help a lot of people out there that may be doubting about how to go about things, and when they hear about what you're doing, they'll probably be feeling energized to do the same thing wherever they are. And we really appreciate that a young leader like yourself has not only contributed so much to the current situation of global health, global surgery in Africa, but also taking upon yourself to pay it forward, helping other people around yourself. And thank you so much for everything you've done.
Thank
Thank
you
you very
so
much, Salome.